review the countercurrent mechanism. I was recording and my phone died, so when I looked up, everything was gone and I finished. So I already have the pictures drawn, so if you need to push pause and draw everything out, that would probably be a good idea. So when we talk about the countercurrent mechanism, the word countercurrent mechanism is basically the renal medulla, how we create and maintain a medullary osmotic gradient. So when we use the word osmotic gradient, we mean that we are getting a different amount of salt concentration on the medulla space versus in the nephron loop. That's what a countercurrent mechanism is going to involve. So we're going to be exchanging materials in the opposite direction. So the countercurrent mechanism is always going to be your juxtamedullary nephrons, and it's always going to be pertaining to the loop of Henle and what's going on with the loop of Henle. So the whole job of the countercurrent mechanism is creating osmotic gradient, which is a different amount of concentrations of solutes in the medulla versus the nephron loop. So it's going to occur in the juxtamedullary nephron. When we talk about the countercurrent mechanism, there's three things that you need to understand. The countercurrent multiplier, again multiplication, the multiplier, the countercurrent exchanger, and concentrating urine and how it occurs. So the word countercurrent is basically going to be referencing the fluid that is traveling down the descending limb versus the fluid that is going up the ascending limb. So it's going to create a current that is counter to the fluid moving up. So it's always going to be opposite. They're doing opposite things. Countercurrent. So the first one is going to be the countercurrent multiplier. So I'm going to basically describe this how you should draw it first. First, you should draw your nephron. Now, push pause, draw your nephron. Whenever we talked about the proximal convoluted tubule, this is where most of your reabsorption takes place. So reabsorption means pulling it out of the tube and into the blood. So in the proximal convoluted tubule, we reabsorb 65% of our water, 65% of our sodium and potassium, which is our electrolytes. We basically reabsorb 100% of our glucose. Now, when you reabsorb all of this back into the blood, the fluid in the blood compared to the fluid in the proximal convoluted tubule are isotonic. So when we compare these two, the fluid in the blood, this represents the blood versus the fluid in the nephron tube, it's isotonic. They're equal amounts of water and sodium and potassium. All the things are equal concentrations. Now, as your filtrate goes down the descending limb of the loop of Henle, we reabsorb water. So you take water out of your concentration. So when you take water out, you're left with more salt. So the fluid is isotonic, and then when water is taken out of the descending limb, it becomes hypertonic. So fluid or filtrate travels up the descending limb, and we take out sodium chloride, which is table salt, and we take it out a lot. So what happens is as the fluid comes up, the water is basically left in, but the sodium chloride is taken out, so we say it's hypotonic once it reaches the distal convoluted tubule. So another thing that we talk about is the medulla, because remember, the countercurrent mechanism is all about keeping the medullary space as an osmotic gradient. So we call this the countercurrent multiplier because every time fluid passes down and water is taken out and a bunch of sodium is taken out, is we increase the amount of sodium chloride in the interstitial space by 4 times. That is where this is the multiplier. It's countercurrent because this side is going to be reabsorbing water and this side is going to reabsorb sodium chloride. Now, one thing I can tell you about kidneys is they're very salty. Wild cats at my old farm, whenever they would kill rats, that's the one thing that they leave behind when they're killing rats, is they don't eat the kidneys of the rats because they're very salty, because deep in the medulla we have so much sodium on the outside because of this countercurrent multiplier. Every time this happens, you increase the medullary space or the interstitial fluid with sodium chloride by 4 times. That's the countercurrent multiplier. Now, the next step is the countercurrent exchanger. So you can actually push pause and draw this nephron again, and we're going to talk about the countercurrent exchanger. Now, in the countercurrent exchanger, we're going to be using the capillary bed that's involved with the juxtamedullary nephrons called the vasa recta. And we're going to exchange from the vasa recta, from the blood to the loop of Henle. Now it's opposite, it's countercurrent. So, first is the proximal convoluted tubule, isotonic, hypertonic, hypotonic. Now, this is the vasa recta. When we talked about filtrate goes into the proximal convoluted tubule. Afferent is to approach. Well, some blood is going to exit the efferent arteriole. So this is going to be your vasa recta. This is showing you basically blood flow. Now, this is countercurrent exchanger, and this also helps with basically reabsorbing everything. So the countercurrent multiplier includes pulling out water on the descending limb and pulling out sodium chloride on the ascending limb. That's the countercurrent multiplier. Now, the countercurrent exchanger is how we concentrate the fluid inside of the nephron loop using the nephron tube using the vasa recta. So, as you reabsorb water from the vasa recta into the nephron, we absorb or secrete rather sodium chloride. This is going to make the fluid inside of your tubule hypertonic. Now on the opposite side, so water, it's just basically everything opposite. On the blood, you're going to basically reabsorb water on the ascending limb, and this is going to help you make the fluid inside of the distal convoluted tubule as being hypotonic because you're reabsorbing water on this side. So this is the countercurrent exchanger. It's using the vasa recta, which is the capillary bed with the juxtamedullary nephron. It is just opposite from the multiplier. So just remember, sodium works in the opposite direction as water on both sides. I think it's easier to remember the countercurrent multiplier and then just remember the exchanger from there. Now, the third way that we talk about concentrating our urine in the kidneys is using antidiuretic hormone. So you draw your nephron out again. So this obviously is showing you the countercurrent multiplier. To remember the countercurrent exchanger, you just use this from the blood coming in. That is the countercurrent exchanger. But this is the multiplier. Every time you have fluid going up the loop of Henle, you multiply the medulla space by 4 times. Now, to concentrate your urine, whenever we're in times where we have low water amounts, we'll produce antidiuretic hormone in the hypothalamus, which is stored in the posterior pituitary. And it's actually going to act on your collecting duct, which is going to pull out your final amount of water out of the collecting duct. And this is going to concentrate our urine being produced, which is going to be emptied into the renal papilla, and then from the renal papilla to the minor calyx, to the major calyx, to the renal pelvis, to the ureter. So basically, this is all part of the countercurrent mechanism, and the goal of it is to concentrate our urine. So you need to know the countercurrent multiplier, the countercurrent exchangers with the blood, and then concentrating your urine is going to involve ADH. Now, one thing we talked about with ADH is caffeine and alcohol are going to inhibit ADH, and that's why you pee an excessive amount when you use ADH.